welcome to today's update. Bit of news from different parts of the world today. We'll be looking at the Americas and looking at Europe. I want to start off today with Japan because I believe this has got some remarkably useful things to teach us about. Now, I am doing a sort of an expanded video on Japan later, at least that's the plan. But let's just look at the basics for now. What got me thinking about Japan this morning was there seems to be a lot of people with antibodies in Japan. The disease seems to have spread through Japan fairly rapidly, certainly through Tokyo, but caused minimal deaths and minimal symptomatic patients. Something strange going on there. We have got a few possible explanations for it, but let's look at the basic facts. Very populous country, Japan, 127 million people. But relatively small amounts of cases and an incredibly small amount of deaths compared, for example, to the United States or the United Kingdom. Now, if we look at the trend in Japan, it's very interesting. So what we see is we had this back in April, May, and then June we went up, and then we've gone down a bit like this. So kind of two waves really in Japan. Very low cases in between. So interesting trend there, but it seems now that many people have been exposed to the virus. But I'm going to look at that in more detail later. But just for now, I think it's worth looking at some of the reasons briefly that Japan has done quite well. One is very widespread mask wearing. One is socially distancing is part of the Japanese culture. People tend not to be noisy. They don't shout at each other on subways and things like that. So we've got these cultural aspects in Japan, but the other thing is they do eat a lot of fish, which could well be tied in with the vitamin D idea. But more on Japan on a separate video. I'm going to leave it there for now because I know not everyone's interested, but I think we've got an awful lot to learn from the Japanese situation. And what came out from looking at this Japanese data was, and how well Japan is doing, is that the interventions that they're carrying out are very low cost. Economically, I think Japan's probably going to come out of this quite well, actually. But stick around for the next video if you want to more details on that. Now, Brazil, population 201 million. First case reported back in March. They've had a lot of cases. Third highest number of cases after the United States and India. Both of those countries have had more cases. And a lot of deaths in Brazil, 150,000 deaths in Brazil. But we do know that a lot of deaths in Brazil have been undocumented, especially in the indigenous peoples' areas like the Amazon, where records are poorly kept. So tragic to see indigenous peoples disproportionately affected in Brazil, and many of them not even given the dignity of being recorded on the official figures. So we know it's higher than that. Second highest globally in terms of deaths after the United States. But interestingly, the cases in Brazil now do seem to be going down. And this is interesting. So here we have the cases in Brazil going up here. But they've been going down for the last month or so now. So this is interesting. So quite why this is difficult to interpret. So it's always worth thinking about testing. Is this related to testing in some way? So here's the graph for testing in Brazil, and we find that's been relatively constant. So I don't think this increase in cases or decrease in cases in Brazil is attributable to changes in testing. Now, of course, we know the leadership in Brazil has been absolutely lamentable. Bolsonaro, no problem. He didn't feel a thing when he had it. It was just like a little flu, he said. So you get the reasoning there. This is from a world leader, bear in mind, that, oh, I had it, I was fine, therefore there's no problem. Classic inductive reasoning, isn't it? No problem for me, therefore it's going to be no problem to everyone else. Well, a minimum of 150,000 of his countrymen would disagree because they're no longer with us. So very strange, illogical thinking there from President Bolsonaro. Now, he opposed the lockdown to prioritise the economy. But as well as that, many people did seem to ignore the restrictions in Brazil. And one of the other things that is a bit distressing about Brazil really is the cases are 4 times more common in the slum areas in Brazil. Now there's a lot of slum areas in Brazil throughout the cities and the countryside, and cases are up to 4 times more common in these areas, and of course the deaths that go with that. But it doesn't alter the fact that the new number of daily cases has been slowly falling since the summertime. Now, this decline in Brazil here could well be due to the fact that so many people have now been infected, that the more vulnerable people have already been infected, and that there is some form of herd immunity starting to take effect in Brazil. It's very hard to tell because of the lack of serological testing, but there's certainly a very, very rapid increase in cases in Brazil. So this could be the case that there's some form of herd immunity now kicking in Brazil, which is encouraging. But of course, the other thing is most of Brazil is in the southern hemisphere. So remember, Brazil is going into its summer now as well, so that could be a factor. And I'm also doing some research at the moment on the BCG vaccine, which is commonly used in Brazil. Again, I'm not going to try and cram that into this video, but interesting possibilities coming from the BCG vaccine as to whether this is the tuberculosis vaccine, of course, as to whether it confers at least a level of immunity to coronavirus 2. So interesting possibilities there. But it's whatever the cause, it's good to see that the numbers are coming down, but it's just so nice if we can explain these things, because if we can explain it, then we can learn from it, as the Japanese data, that we can learn from that, and hopefully help the rest of us who are, let's just say, not going in such an encouraging downward direction at the moment. My country in the UK, for example. Now, Colombia is the next worst affected country in South America. Largely due to population, relatively large population in Colombia, getting on for 1 million officially confirmed cases. So pretty good testing program in Colombia. That's a lot of confirmed cases. The real number of cases, of course, is going to be higher. But again, the deaths, well, less than the UK, the official number of deaths, 27,000. And again, we see this interesting pattern. So we've got the increasing cases there, as we know, then the decrease in cases there, and it's not quite clear what's caused this decrease. However, with Colombia, unfortunately, we are seeing a bit of a kick up at the moment. So definite trends there, but again, rather difficult to explain why there is this reduction in the cases in Colombia over this period of time, and now why there's an increase. So quite a few frustrating unknowns there. More information to come on that soon, no doubt, and we'll certainly be following it for the large populations, and therefore it's important to follow that. Now, the United States, let's just have a quick look at the screens. 213,000 deaths, unfortunately. Yeah, there's a lot of deaths in the United States. 335,000 cases in the past 7 days. Now you can set this to give whatever data you want. This is set for the past 7 days, so obviously the darker the colour, the more cases in the past 7 days. So up in the Midwest, Wisconsin, for example, quite dark, and Illinois quite dark coloured there, and also North Carolina and Tennessee looking darker than they have done. So do look at that graph for yourself. It's easy to get. You can just Google it, or I've posted the links. And then the trends in the States. Again, we are seeing this definite upward trend now in the 7-day rolling average. And frustratingly, the deaths in the United States have never come down significantly like they have in the UK, for example. So the deaths there, we're still looking at just over 900 deaths every day there in the States. And yeah, the deaths have stayed up in the States. It's really quite sad, whereas, well, it's tragic. Whereas in the UK and Europe, they've been down over summer. but the United States not enjoying the same respite in deaths, accounting for this this large number here. So United States, there's the information there. Now, I've got the hospitalisation data from the States, yes. Now this is strange because we have looked at particular states like we looked at Wisconsin, for example, where they're opening emergency hospitals, and yet when we look at the national data for hospitalisation in the States, it's quite surprising, and if this is accurate, it's also quite encouraging, although it's not reflected in the deaths. Because look at this dramatic drop in the number of hospitalisations in all age groups in the States. And that data is from the 3rd of October. So always a bit of a delay, of course, but remember we're looking at the data there, and I was pretty well expecting an increase, but quite a gratifying decrease there in hospitalisations. So I think what we can say about the States is it's very patchy. Although overall hospitalisations are down, there are hotspots where hospitalisations are unfortunately going up. So we are seeing somewhat of a disparate picture, I think, in the United States. Now, Wisconsin, we looked at the emergency hospital that's been opened in near Milwaukee, wasn't it? I think that's Wisconsin. Stay at home, avoid public gatherings is the advice at the moment. Increasing drive-through testing. So Wisconsin, definitely a much darker colour than we would hope. Oklahoma, this caught my attention. Chelsea, the entire police department closed because every officer tested positive. Now, clearly, police officers, by the nature of their work, are more exposed than many of us. But for every officer to become infected, I don't know how many police officers there were in Chelsea PD, but the whole place has closed down because every officer has become positive. So were they doing something wrong? Were they just particularly unfortunate? I don't know. Do let me know. But amazing that every officer has been affected, and all are quarantining. So they're all doing the right thing. We are pleased and gratified to learn. Now, Arizona has been selected by the where am I going? There I am. Arizona has been selected by the CDC for special praise, which is good. So let's look at that and celebrate with Arizona. So population 7.3 million. Do look up some references on what I'm about to say yourself. Low rates of infection, March, April and May. Now the governor, Doug Ducey. Now just before I go on, I'm going to say I have not looked at which political affiliation Governor Ducey is from deliberately. So I don't know if he's Republican, Democrat or somewhere in between. I have no idea. So I've deliberately not looked, and I don't know the political affiliations of all governors in the United States, surprising enough. So I simply don't know. So I'm making these comments from a completely apolitical, hopefully lack of bias. I literally don't know what party he's in. But he says this, we are clearly on the other side of the pandemic. Now, this was back in mid-May. Now, optimism is good, but in this case, it was clearly misjudged optimism. So there was a reduction of restrictions. And of course, as we would expect, end of June, hospitals have got very busy with a massive increase in cases. But having realised the error, the Governor Ducey introduced local mask mandate started in June. And closed all bars, gyms, water parks and movie theatres where there could be a lot of spread. And as a result, cases went down 75% in a month. Impressive. And the CDC has celebrated that by putting one of these nice graphics on their website. So 151 increase in cases after stay-at-home order lifted, 75% reduction in cases following sustained prevention efforts across the state, including very widespread mask wearing. So always good to get a special graphic from the Centre for Disease Control. Now the CDC have also said about this, widespread implementation and enforcement of sustained community mitigation measures like mask wearing, public informed by state and local officials. So they're saying this is good because the implementation measures have been widespread. Mask wearing, the great thing about mask wearing is we believe it works, well we know it works as much as we can know. And of course it doesn't cost anything. You know, just think about the amount of money that is being spent in this pandemic, and mask wearing costs nothing. Masks are critical, not political. So whichever party Governor Ducey belongs to, I don't know, but he promoted the mask wearing and these other measures. Public informed. This is another theme that's run through this whole pandemic. Populations behave better if they are fully informed. And the CDC here are commending the authorities for keeping the public in Arizona well informed. Good. They also point out there's continual data monitoring and collaboration between different agencies. That's helped to prevent transmission and decrease the number of cases. So good news there. Just shows that even when you've got a very large amount of cases, even if you've got a massive increase in cases like we saw here in Arizona, then implementation strategies still work. In other words, it's never too late to intervene and reduce spread. And most of the costs there, okay, there's economic costs for some of the interventions, but many of those interventions don't cost anything, which is good. Now, talking about measures that don't cost anything, let's go on to Texas. This is Rice University in Houston. Put up these huge, absolutely huge marquee tents. Lots of ventilation, absolutely brilliant. Lessons going on in there. Students and staff tested every week. Positivity rate in Rice University is 0.1%. So for every 1,000 tests that are done, one comes back positive. 0.1% positivity rate, indicating there's very little community transmission in that community. Compared to the rest of Houston, which has a positivity rate of 5.8%. But Rice University have spent $20 million. Not cheap interventions. Seems a pity to spend all this money when much cheaper interventions can help greatly, as we just saw in the Arizona example. So that shows it can be done, it is being done, but at a cost. Now, moving on to the UK now. Where are we? Yeah. UK increasing cases. Now, that was the increase on Sunday, so Sunday the figures are always out a bit. But these numbers are increasing sharply, 81 deaths on Saturday, I think that was. But more up to date, the COVID symptom tracker app is showing 24,000 new cases. Current cases, wow, is that right? 800, have I got that figure right? It seems awfully high. Current cases, I'm not sure if I've got that right, it seems awfully high. But anyway, for sure, 24,000 new cases in the day. I don't think that can be right. Let's check that. I'm not convinced by that figure. Right, but check it out for yourself. It's there, and I will correct that on the next video. But what we can't argue with is the data in the UK. So we had the initial peak here back in March, April, way down over the summer months, and now there is no ambiguity about the direction of travel in the UK. It is definitely going up, increasing in cases and quite dramatically so as winter approaches. So that is the direction of travel in the UK at the moment. We are expecting new measures to be announced today. I'm not going to go into them now, but we're expecting new measures today. Of course, what's important is the hospitalisations. Actually, just before that, we'll notice that these levels here were gross underestimates. The real numbers of cases in this period of time was about times 50, what we actually see on the graph. So what we're seeing now, with about 15,000 or so new cases per day officially there, is way less than it was then. What if we actually had the number of cases here on this scale, it would be these numbers would have been like way up here somewhere like that on a linear scale, because the numbers that were actually times 50 what they were there. So we're nowhere near where we were back in March, April. We're nowhere near that, but the trend is bad, and it's the trend that's the point. Now, getting on to the point I was about to make, the hospitalisations. So this first one here is patients admitted to hospital in the UK. Actually slightly down this week, 612 patients admitted to hospital there. Yeah, I mean the 7-day rolling average is 580, so it's significant, but it's nowhere near what it was. And the total number of patients in hospital, yeah, that has gone steadily up, so just over 3,000. And of course, these are patients in hospital with SARS coronavirus 2. So the trend is definitely increasing, and for patients in intensive care, 410 in the country at the moment. So hospitalisations certainly starting to increase. And if we look at the I've got a graphic here for Europe, because we're kind of onto Europe now. So France, now the United Kingdom's got a dip down there. That I don't believe that. That's an artifact. Netherlands increasing, France increasing, and these are all adjusted per capita of the population. But heck, I mean, whichever country you're looking at, we have got very definite European increases, haven't we? So unfortunately, no real doubt about the direction of travel in Europe. So just while I'm on these pictures, I'll just show you the one I did of the Americas, slightly out of place, but this is the Americas. So confirmed new daily cases, United States, Brazil, Colombia. But then if we adjust that per capita, we actually see that they're much more similar. Colombia increasing, the United States increasing, Brazil going down, as we've said. But we're all kind of, the cases here are still high, but currently we're all kind of in the same ballpark, with the difference that Brazil seems to be on a downward trajectory, whereas the United States is on a shallow upwards trajectory, but Colombia on a steeper upwards trajectory as we look at the data from today. Now, just before we finish the UK, safe distancing on TV interviews with the BBC that I've noticed. So it looks like they're keeping people 2 meters apart, or slightly less, it looked like to me on the BBC. But they're there without masks, talking for a long period of time. And of course, when you talk, you're aerosolizing, and it just diffuses out, because we know this disease is aerosolized, hangs in the air. So it doesn't seem to me that the BBC is setting a very good example at the moment, especially as there doesn't appear to be any breeze blowing through their studios. So I would really hope for a better example from the BBC that's just not there at the moment. They seem to be obeying the letter of the law without the spirit of the law, and seem oblivious to the need for ventilation. Anyway, that's just me being grumpy, but with some justification, I would hope. Anyway, now this is something else I've been looking at the past few days: BCG vaccine for tuberculosis. Now, we've commented on this before a couple of days ago. This vaccine started in 1921 to vaccinate against tuberculosis. and we stopped vaccinating in the UK routinely for BCG. So I had it when I was a child, but apparently the anti-coronavirus effect of the BCG, which isn't proved yet but does appear to be there, wears off with time. So it looks like we need booster TB vaccines. So this is very encouraging because this is a vaccine that's tried, tested, known to be pretty safe, well, very safe. And if this gave us some protection, it would be seriously good news. So the UK has joined the trial international BRACE study. Now, BRACE is the BCG vaccination to reduce the impact of COVID-19 in healthcare workers. Of course, you can't make BRACE out of that, but it's called the BRACE trial, even though it doesn't stand for it. Now, what this trial is doing is looking at healthcare workers to see if the BCG tuberculosis vaccine gives them some degree of protection, because of course healthcare workers are more exposed than other people. So you can get you can expose your sample quicker. So part of the international BRACE study, Australia, Netherlands, Spain and Brazil are already taking part, recruiting 10,000 people. And if that works, that would just be seriously good news, that the BCG vaccine would confer a degree of immunity against SARS coronavirus 2. Interesting. Now, Netherlands, because we're on Europe today, Netherlands population only 17.3 million people, but the cases are increasing. Deaths still relatively low, it has to be said, which is good. Now, data from the 16th to the 22nd of September, they had 13,471 new cases, but remember that's a relatively smaller population. But again, it's not so much about the number of new cases, it's the trend. So that's the third week in a row major increase in infections. And also, this is what is concerning, 6.1% of the cases are coming back positive, indicating there's a fair degree of community transmission. And again, when we look at the graph, the now familiar lump there went right down, but now there's no question that the trend is accelerating upwards. A very similar shaped graph actually to the UK. So if you look at the shape of the, that's the Netherlands graph there, that's the UK graph there. So UK, Netherlands, very similar trajectory. Now, the Netherlands, we did criticise them on this channel for advising against wearing masks just recently. But now, as of the 2nd of October, I'm pleased to see that the medical authorities are now advising the wearing of masks, strongly advising the wearing of masks. Having said they made no difference for ages. Who knows? Maybe they listen to the video and change their mind. I doubt it, but I'm glad that they are changed their mind on that one. Better late than never. We did criticise them very strongly a couple of weeks ago for their advice on not wearing masks, but now they are advising wearing masks. So that's after saying they don't work, because that was wrong. We believe they do. Masks now are advised in all indoor public places, car sharing, but they're not mandated, just strongly advised. But I believe people in the Netherlands are now wearing masks more commonly. So let's hope that continues to increase. They are mandated at Schiphol Airport, public transport, that's in Amsterdam, isn't it? Just outside Amsterdam. Public transport, private and commercial transport. Oh, the other thing about Netherlands, and the reason that this is that this graph is certainly a gross underestimate of cases, is that you have to be symptomatic to get a test. They are still not chasing up and testing contacts. And I must say I'm surprised. For an advanced country like the Netherlands, this is surprising. I would have expected a much higher level of organisation in the Netherlands. So that means that the number of cases being reported are actually way higher, because you have to be symptomatic to get a test. And there's delays for testing as well, which is unfortunate. Hospital admissions, intensive care admissions and deaths are increasing. More hospitalisations in the past week in the older age group as well. And because this is in the older age group, we know that this will feed through into some more deaths, unfortunately. So Europe is definitely heading into what we could call a second wave in most places in Europe, and the winter has only just begun. In fact, it's hardly begun at all. It's still autumn, really. In fact, it is still autumn. Right, okay, I think that's all I wanted to say today. We'll just talk about dogs. Why aren't we using more dogs? I have no idea. People are starting to do it now. I'm trying to get an interview at the moment with the person who's in charge of medical dogs in the UK. That they have agreed to talk to me. It's just when they get time. They're obviously very busy people. But I'm looking forward to that, talking about medical diagnostic dogs in the UK. Now, diseases smell, and dogs can smell this because their smell is 10,000 times better than ours. Now, even me as a mere human, I can actually smell some diseases, I think. Certainly when someone has Pseudomonas bacterial infection, I can smell that you can smell that as soon as you walk in the room. You can go, Pseudomonas. You recognise the smell of different types of bacterial infection. And people with appendicitis often have a very characteristic toxic smell as well. So even humans can get used to, can make some diagnoses from smell. I know I've certainly sniffed wounds and said, oh, that's a Pseudomonas infection. Sent off the culture, it comes back and it is. So, and once or twice abroad, I've actually prescribed, I've actually used antibiotics based on the smell. And the results are normally pretty good, actually, I must say. Not the way you should do it, but it just shows that even a human can learn to smell certain diseases, and some people seem better at it than others. I'm not particularly good at it. Of course, it takes many years of experience to learn to smell diseases, but I've talked to some old doctors who believe that they could diagnose quite a few diseases from the smell. Anyway, I digress slightly. Dogs have been used to test for malaria, bacterial infections, cancers. And the one I find utterly amazing, and I can't think it's to do with smell, but dogs can detect when their owners are going to have epileptic fits if they're properly trained. It's just amazing. And what is it they're detecting? Does someone give off a particular smell before they have a fit? I have no idea. But whatever it is, we need to use them more because dogs are great for this sort of thing. Now, London School of Hygiene and Tropical Medicine, collaborating with the Medical Detection Dog charity, which is a non-profit organisation in the UK. Funded by the UK government, which is wonderful, in collaboration with the University of Pennsylvania. Now, James Long is the London School of Hospital and Tropical Medicine's Department of Disease spokesperson on this. And he says, we're not just doing proof of concept work. Well, they are doing proof of concept work, but they're doing more than that. We're also working out actively how to deploy this and scale it up as well, because we want to hit the ground running once we've gotten our results. And we'll come on to socks in a minute. So in other words, what Dr. Logan here is saying is that they are doing the testing to show that dogs can detect SARS coronavirus 2 with a good degree of accuracy. And then once that is demonstrated, they've got plans for rolling this out across the country, greatly improving our diagnostic capacity using dogs. Now, the reason I've got socks down here is this study is, well, the background here is they started off using armpit sweat and the dogs seemed to be able to smell that. They used sweat from other parts of the body. The dogs seemed to be able to smell that if the person was infected with SARS coronavirus 2. And now they're using people's socks. So these poor dogs have to sniff people's socks, although strangely enough they don't seem to mind. And we're working on data as to whether they can make diagnosis from the smell of people's feet. What is unclear is how long before someone becomes symptomatic the dogs can detect SARS coronavirus 2, but it looks like a few days, possibly quite a few days. So very encouraging using dogs in diagnosis. So if you could have a queue of people waiting to go in a cinema, for example, just run a dog along it and the dog will sniff if anyone's got the virus. I mean, the potentials here are just mind-blowing. Now, the German study We've looked at other studies, but just one example, German study. 83% detection rate, 4% false positives, as opposed to other rapid tests which are 84% detection rate and 2% false positives. So just about as good as these quick tests. Not as good as the PCR tests, of course, but just about as good as these quick tests. And this was after these dogs here, or I suppose we should say these hunts, because it's German. These hunts had only had 1 week of training. That is pretty smart. 1 week of training, and they're almost as good as the chemical tests. And dogs in America and dogs in the UK, I believe, are just as smart as German dogs. So great potential there. Let's hope people use it, not only for SARS coronavirus 2, but for all diseases. And of course, the dog diagnoses in a few seconds. You don't have to wait for the test coming back. And they are also being used, as we've looked at before, at Helsinki Airport. Good. I think that's all I wanted to say today, actually. So, I mean, obviously, the serious concern is we're heading into winter in the northern states and in Europe, and cases are increasing. But we've seen here that simple measures like in Arizona, mostly inexpensive measures like in Arizona, can make a real difference. And this is what we have to carry on promoting. Otherwise, we are going to get increased hospitalisations like the Netherlands are getting already, and we're going to get increased like the Netherlands are getting already. And unfortunately, the deaths in the Netherlands are going to carry on increasing, because unlike over summer, where it was mostly young people that were infected, now the older age group is also being hospitalised. Okay, thank you for watching today, as always. Always great to have you.